Friends, once people believed that liver is the main organ for pumping blood throughout the body. That belief lasted for nearly few hundreds of years until William Harvey proved in 1628 that blood is circulated in a closed system and pumped by the heart, not the liver. So things changes time to time, but we have to rely on present knowledge. As per my understandings, after digestion, carbohydrate foods turn into glucose and goes to blood. Insulin, a hormone produced from pancreas beta cells, allow body cells to absorb glucose from the bloodstream and immediate energy is produced inside cells. Extra glucose is turned into glycogen and stored inside liver and muscles for future use. More glucose, if received, turns into fat and stored into body lipogenesis. And in both cases, insulin helps. When in any case insulin cannot perform properly, insulin resistance or lack of insulin, amount of glucose increases in the blood, which we call diabetes mellitus or type 2 diabetes. In type 1, body does not produce insulin at all. Now, when insulin is ineffective or less, what happens? Glucose level in the blood rises. Body try to decrease that level through kidney, polyuria, or urinating several times. When one urinates several times to excrete excess glucose from the body loses water, osmotic diuresis. Then body becomes dehydrated and wants to take water again and again. The person concerned become thirsty, polydipsia, excessive thirst. Not only water, glucose also goes out with water, but body needs energy through glucose, so it needs food. Body interprets lack of energy as a need of eat more food. Patient become hungry, polyphagia. So three P's are polyuria, polydipsia, and polyphagia. Another P is peripheral neuropathy, nerve damage. So lack of insulin or effective insulin is a great hazard for the body. Pancreas produces another hormone named glucagon produced from alpha cells, which helps to increase blood sugar level in case of hypoglycemia. Glucagon helps to convert stored glycogen in the liver into glucose again, or it inhibits glucose to glycogen conversion and storing inside liver, etc. And thus try to maintain exact glucose level in the blood. Glucagon can also convert glucose from non-carbohydrate subjects like lipids, amino acids, etc. Gluconeogenesis. Actually, pancreas secretes digestive enzymes from one part, exocrine part, and insulin, glucagon, etc. from another part, endocrine part. Now, diabetes insipidus is different from diabetes mellitus and characterized by extreme thirst and excessive urine. This is a lack of or resistance to vasopressin hormone, which regulates water retention. Now about homeopathy. In homeopathy, treatment is done on the basis of patient's symptoms and constitution. Treat the patient, not the disease. So any medicine, if it suits the constitution of a patient, it helps him to progress for good health. Still, there are some other tinctures like Syzygium jambolenum, Cephalendra indica, Ajatidacta, indica, or neem, etc., and some homeopathic medicines like phosphoric acid, lactic acid, netramur, etc., which may help. Nash, in his Leaders in Homeopathic Therapeutics, says about phosphoric acid. Phosphoric acid, in case of phosphoric acid, we find very profuse watery or milky urine, says Nash in page number 241. Other symptoms must be considered. He also says we must distinguish between the profuse urine of Ignatia and phosphoric acid, for the first is hysterical and the latter is not at all so. Is number 244. Now we can mention that a peculiar symptom of phosphoric acid is involuntary biting of tongue in sleep, reference Clark's Materia Medica. And in case of Ignatia, we can say in talking bites inside of cheek, Ignatia, reference Allen's keynote. Lactic acid. Nash says in his Materia Medica, page number 469, lactic acid is a great remedy for diabetes mellitus. It is specially indicated if, in addition to the thirst, voracious hunger, and profuse urine loaded with sugar, there are rheumatic pains in the joints. It is generally given low, but abundant experience has taught me that the high is much better and it does not need frequent repetition. Farrington, in his Clinical Materia Medica, page number 518, says principal acids for diabetes mellitus are phosphoric acid and lactic acid. Farrington, in his Materia Medica, in page number 568, says phosphorus may also be remembered in diabetes mellitus and Bright's disease when these have been preceded or are accompanied by disease of the pancreas. He says in page number 28, lac defloratum or skimmed milk has been used largely in the treatment of diabetes. As per Allen's keynote, phosphoric acid patients are prostrated and stupefied with grief, apathetic. Urine forms a white cloud at once, phosphates in excess, nerve washed. Many more medicines may be considered, but everything should be done by professional homeopathy consultant. To conclude, I can say regular monitoring is needed. Managing chronic condition like diabetes should always be done by healthcare professionals, but lifestyle change is first needed and some managements which your doctor must guide you. Thank you.